The day that my mom, who has a known medical history of hypertension, had a skull-crushing headache, I was glad I knew how to check her blood pressure to see if she was in a hypertensive crisis and needed emergency medical care. Hypertension is a common ailment amongst American adults, and being able to check yours and your loved one's blood pressure at home accurately and frequently can be key in keeping you and your loved ones healthy. A manual blood pressure can be taken on the arm by following a simple step-by-step procedure. Today, I'll be talking about 3 points. First, gathering the equipment. Second, ensuring proper setup. And third, taking the blood pressure. Let's get started with my first point, gathering the equipment. According to nurse.com, the equipment we need is a sphygmomanometer, which is a blood pressure cuff with a gauge and bulb attached to it, and a stethoscope. I received my blood pressure cuff from my CNA training and my stethoscope from work, but you can easily get these pieces of equipment either at your local pharmacy or order it online from something like Amazon. According to nurse.com, it is imperative that the size of the blood pressure cuff is appropriate to avoid a false reading. There was one time I was at work and I took a patient's blood pressure and it came out really low, like dangerously low. And it didn't really make sense because she looked fine and she felt fine. And so I checked her blood pressure cuff to see if something was going wrong there. And it turned out it was just too big for her arm. And so I ran and grabbed a new one, a smaller one, rechecked it, and it came out much better, more normal. Now, for my second point, ensuring proper setup. According to the CDC, the arm that you're taking the blood pressure on needs to be on a flat level surface and in line with the heart. There was one time my fiance was sitting on the couch and he felt really woozy and lightheaded, and so I ran and grabbed my blood pressure equipment to check his blood pressure, and because he was sitting on the couch, his arm was kind of just dangling by the side of him, so I propped it up on some pillows, and when I checked his blood pressure, I felt confident that the reading was accurate because I had taken the extra step of making sure it was level with his heart. According to the American Heart Association, it is best practice to have a patient rest for at least 5 minutes before taking the blood pressure to avoid a false high reading. There was one time I was at work and I took a patient's blood pressure and it came out pretty high. And so I was like, "Hey bud, your blood pressure is pretty high. It's like 170 over something." And he was like, "Oh, that's probably because I just came back from the bathroom when you walked in." And I was like, "Oh yeah, probably." So I had him sit for about 5 minutes. I went and checked some other blood pressures, and when I came back and rechecked his blood pressure, it was way better. It was like 140 over something, which is still a little elevated, but definitely better than 170. So we've talked about gathering the equipment and ensuring proper setup. Now for my third and final point, taking the blood pressure. According to the Mayo Clinic, now that we have the appropriate sized cuff on the arm and it elevated at heart level, we will place the stethoscope on the inner elbow and inflate the blood pressure cuff to 30 millimeters of mercury higher than their normal systolic pressure. Whenever I take my blood pressure at home, I check my MyChart or my electronic medical records to see what my last blood pressure was and then go from there. So my last blood pressure was 124 over 82, and so if I took my blood pressure today, I would inflate the cuff to about 154. According to the Mayo Clinic, our next step is to deflate the blood pressure cuff at a rate of 2 millimeters per second, listening for the first heartbeat, which is the systolic blood pressure, and the last heartbeat, which is the diastolic blood pressure. When I was first learning how to do blood pressures, I had to redo it so many times because I had such a hard time being certain when I heard the last heartbeat to get the diastolic pressure. I was always like, did I hear another one? No. So it just takes practice. So in conclusion, a manual blood pressure can be taken on the arm by following a simple step-by-step procedure. We've talked about 3 points. First, gathering the equipment. For example, having a sphygmomanometer with a proper fitting cuff and a stethoscope. Second, ensuring proper setup. For example, having the arm level with the heart. And third, taking the blood pressure. For example, by inflating the cuff and listening for the first and last heartbeat. When I was able to check that my mom's blood pressure headache was due to not enough water and not due to a hypertensive crisis, I was glad and very relieved that I had this skill and knew how to properly check her blood pressure.